And getting back to diabetes, and I just want to tell you about sort of my journey with the type 2 diabetes uh, that I information or the diagnosis I got in 2014. And I remember at that time I was absolutely horrified and so disappointed in myself that I went completely hardcore and read everything I could and watched a lot of internet stuff on how to um, uh, cut sugar out of my system as much as I could. And for the 2 months before, there was a mandatory course that I had to go on and was put on by the province of Ontario. And they said, you're going to see a nurse and a dietitian. And I was in a classroom with all these other people. But for those 2 months when I went hardcore, completely miserable, hated my life, hated everything. Go to the course. And they said, all right, Kevin, first of all, because of the family history, you were going to get on that diabetes train. And yeah, you might have worked out a little bit harder, but and might have delayed it another few months, or you could have let yourself go and got on that train sooner. But irregardless, you're going to get on that train. So welcome to the human race. You're, you're just normal, and accept it. And let's work on getting your diet under control. And one thing I found out was that in the office that I was working at, in the basement was a cafeteria run by this lovely Indian couple. And every Wednesday was butter chicken day. And I would notice that every time I had my Wednesday lunch, which everyone in the building seemed to look forward to, my blood sugar system would just go through the roof. And my and so I cut that out. And the nurse had a talk with me as well as the dietitian, one on one. And we went through that and said, Kevin, when you have butter chicken, how do you feel? I feel fantastic, but I know it's bad for me. And every time test myself after that, it goes through the roof. Well, Kevin, if you know that's going to happen, stop testing yourself after that. All right. And instead of having it every week, try it once a month, and then try it once every 2 months, once every 3 months. And that seemed to have worked. Now, uh, I've got my diet under controls, and ever since then, I was diagnosed with that Waldenstrom's thing, which I don't want to talk about right now. But health-wise, and going through right now, not being so miserable and still having the occasional butter chicken, maybe once every 4 months, life is good, and I'm enjoying life again. So it's all right to be human. Recognize it. Know that when you fall off the wagon, as I did when I have the butter chicken, the next morning it's back to the gym, back to no rice, quinoa, and whatever. Just go back, but still trying to enjoy life, even though you're under restrictions. Thanks.